All right, so welcome everyone. Today we have a presentation from Patricia Watford, and she's from the Augusta University. The presentation is a geriatric interprofessional education program, and it's a mixed method study. So I'll pass it over to you now, Patricia.
Okay, thank you so much, Jo. Thank you everyone for being here. We're really excited that you are watching our presentation. There are 4 of us here presenting today, but I want to introduce the entire group who actually came up with this activity and who is helping to complete the study. So there's myself, I'm an occupational therapist. We have Megan Hall, she's also an occupational therapist. We have Colleen Hergott, she is a physical therapist. Nicole Winston, she's a pharmacist. Wanda Giroux Rosalie, she's a physician. Shilpa Brown, also a physician, and Elena Wood, also a physician. And we are from Augusta University. And we will go ahead and get started. Okay, so let's talk about the background and the relevance of our activity. So the importance of interprofessional collaboration for healthcare students is well documented in the literature. It has been shown to improve health outcomes for patients. This includes reducing medical errors and reducing healthcare costs and inefficiencies. It also increases healthcare workers' job satisfaction, increases mutual respect and trust between the different disciplines, and increases effective communication. And also, another reason we chose to work with the geriatric population is that we're finding in the United States that the aging population poses many challenges to our healthcare system. So as people are living longer, they're living longer with more chronic diseases and chronic illnesses, and also living longer with more comorbidities, which definitely has been a challenge to our healthcare system and healthcare systems around the world. So the reason that we decided to come together and participate in this activity was our primary outcomes were to evaluate our students' perceptions of interprofessional team interactions. We wanted to evaluate their attitudes toward geriatric patients and also their levels of clinical empathy, both before and after our 4-hour geriatric workshop. Secondary outcomes that we looked at were evaluating the students' overall perceptions of the geriatric workshop in general. So just an overview of our activity. We planned an active learning, a hands-on 4-hour workshop. The students who we had participating were medical students, occupational therapy students, and physical therapy students. We actually ran the activity over 4 days. We repeated it each day to accommodate all the students. You'll see when we get to the results, we had quite a few medical students, and we needed to repeat that over several days to accommodate all of these students. We did pre-testing and post-testing and a focus group, and this was all designed for curriculum evaluation. And when we saw our results, we thought, wow, this is so great. We've got to write this up and share this with other people. So we decided to write it up as a sequential explanatory mixed method design. So pre-test and post-test, students were sent links via the Qualtrics XM platform, and the link was emailed to each participant about a week before the activity happened. And then the post-test was emailed to them via a link immediately after the activity. So in the pre-test, we had the Attitudes Toward Healthcare Team Scale, the UCLA Geriatric Attitude Scale, the Jefferson Scale of Empathy, and then for the post-test, we had those same 3 measurements, and we also had faculty questions that we created about student perception of their ability, and also questions about their overall perception of the workshop. We wanted to get student feedback so we could possibly change it the next year and make it even better. So the flow of our activity, first we had the pretest, then we had the workshop, and we had the post-test, and we did some preliminary analysis of the results from the post-test, and those results guided our questions that we asked in the focus group. We used a case study format. We created Mr. Nathan Holderfield. He is 73 years old. He had a recent hospitalization for pneumonia. He had congestive heart failure, dementia, dysphagia, and macular degeneration. All of the faculty involved in this activity have all worked with older adults, and this was pretty typical for the clients that we saw, someone with multiple comorbidities, and some of the diagnoses he had were very similar to the clients that we have seen in the past. And now I'm going to turn the presentation over to Megan Hall, and she's going to discuss the specific activity that we ran.
Hello, thank you so much for your time and your interest in our activity. So a little bit about just the pragmatics of how we organize the interprofessional activity. We began each afternoon with an orientation for the large group where we spent 30 minutes overviewing the purpose of the interprofessional session, introduced the involved faculty. We introduced the case study and had the students start to identify some of the key issues in the case study. We presented an overview of the 6 stations they would be attending and rotating through. And then the students broke into their 6 predetermined interprofessional education groups. These were each named after an activity of daily living to promote a little bit of a sense of a team within those groups. And then the students were dismissed to their first station with a facilitator to help with the flow. There we go. Okay. In each station, the students spent 20 minutes and then rotated. The first station was a cognitive screening station led by a physician. The second station was a virtual reality station in which the students experienced a virtual reality simulation of macular degeneration, also led by a physician group. The third station was a dysphagia group led by myself, an occupational therapist. The fourth was a home safety station that was conducted in a simulated apartment setting that was led by an occupational therapist. There was a fall risk assessment station led by a physical therapist, and then a geriatric pharmacotherapy led by a pharmacist. Just a little bit more detail about each of the stations. In the dysphagia station, the students were given the opportunity to use the case study to identify risks and signs of dysphagia, and they also learned about assessment and intervention with some hands-on interactive activities where they actually got to practice some of the swallowing maneuvers and thickening of liquids that are involved in dysphagia intervention. In the home safety station, the students came into a simulated apartment and performed a home evaluation, identifying home safety errors that were set up to simulate some of the common home safety issues in the geriatric population. In the fall risk station, the students performed the Centers for Disease Control study group of assessments and identified interventions that would help with the issues identified from those screening tools. In the cognitive function station, the students performed and interpreted the MOCA on a standardized patient and then evaluated in pairs the results and some of the implications for the case study. In the pharmacy station, the students received a list of the case study patients' medications and were able to identify inappropriate medications and create a plan. This was also to simulate some of the most common safety risks that we see in the area of pharmacy for the geriatric client. And in the virtual reality station, the students experienced macular degeneration and were performing simple tasks while experiencing the limitations that come with that diagnosis. Following the rotation through the 6 stations, the students debriefed together, back together in a large group where faculty summarized each station. The students shared their perspectives of what they learned, and the students identified the benefits of working in an interprofessional group for the management of geriatric patients. I will now hand it over to Nicole Winston.
All right, hello everyone. As everyone has been saying, thank you so much for attending our presentation. So for the results, as we had discussed, this was a mixed method study. And so as a part of this, all of the students in our medical school, occupational therapy, and physical therapy at a particular time and place in the curriculum were able to participate. Okay, so you see we had a large number, a total of 266 students total, the majority of which were medical students. We made sure as in terms of the groupings that each group had occupational and physical therapy students, so it was a true interprofessional event. For the focus group, we had 5 medical students, 2 occupational therapy, and 2 physical therapy students participate in that. So for our results, we had discussed that we used several different surveys and questionnaires, both pre and post, to evaluate the impact and influence of this particular workshop for all of the students. As you can see, our IPE survey, which looked at the attitudes towards working on a healthcare team, there was a difference here. Particularly, we did see significant differences between the pre and post survey. So overall, thinking about the growth that they had during that particular event. For the Jefferson Scale of Empathy, there was an increase overall, but that did not necessarily reach statistical significance, but we did see growth in terms of empathy. And then finally, the UCLA Geriatrics Attitude Scale. Overall, they were pretty similar pre and post. And we may talk about a few reasons for that, but overall, the main significance that we did see was in interprofessional education and their attitudes towards that. So the value of not only evaluating students in terms of surveys, but also getting the richness of what they think about and their perceptions in terms of the focus group was really vital for what we created in terms of the outlook of this particular workshop. So as a part of this, once we had the focus group, it was transcribed, and then we worked as a team to identify themes and sub-themes that we saw throughout the data. And as you can see here, 4 overarching themes were identified. So collaboration, team roles, value of IPE, and recommendations for the future. So as you can see under collaboration, 2 of the sub-themes that we saw were communication and respect. Many of the students talked about that, and we'll have several quotes here to identify those and give examples. For team roles, what the students talked about is an awareness of their roles and responsibilities in their own profession and how that connects with the other professions, the responsibilities that they have, and in particular, how the referral system works here in the United States. They also talked about the value of IPE, how they got a different perspective of how these particular professions work together, and a desire to do more. And then finally, as I had stated, the overarching theme, recommendations for future, more critical decision-making to add to the workshop, preparation on the student side, and then the timing in the curriculum to better complement where each of the students are in their respective curriculum. All right, so the next few slides, we wanted to provide some examples, some direct quotes from the focus group. So in terms of collaboration, one medical student shared, if there is a PT and an OT involved, make sure that there's anything that affects the patient's care, call them. Let them know this is going to be changed. For PT/OT, if you see things changing at home, calling us and letting us know there might be a problem that needs to be checked out for the next appointment. So that kind of keeping the eyes and ears open for different professions to provide the optimal care for the patient. For team roles, one of our physical therapy students stated, just working with the team is valuable because you're able to see physical therapy therapists are the specialists in this area. Physicians, of course, are the specialists here, pharmacists here, OTs there. because we have to know our own stuff, and we actually have to know the other of the other information that the other fields are as well, that helps them identify and understand their team roles. For the value of IPE, an occupational therapy student explained, I think everybody really enjoyed it, and if there was ever a future opportunity to maybe have a course like an interprofessional class, that would be really cool. And then recommendations for future IPE, physical therapy student pointed out it would be really beneficial to them if you gave them the case beforehand so that they could prep. And we'll talk about some of the changes that we most recently made. And now I'm going to hand it over to Colleen Hergott.
Thank you. It's a pleasure to be here. So we know that interprofessional collaboration practice and teamwork are critical for safe, high quality, accessible patient care. And we also know that failure of communication and collaboration by members of the healthcare team results in negative patient outcomes. Consistent with findings from other geriatric IPE studies, participation in this 4-hour activity increased the students' appreciation and understanding of IPE. And it really helped them understand what it means to be part of a team. We found that they had a different perspective of what the others do and how they fit in, instead of just being siloed in their own profession. So as far as limitations go for this study, we did only include students from our single institution, and as well as discussed previously, medical students comprised the majority of the participants. About 71% were medical students. We also were limited in the students completing the post-testing, with only about 45% of the students doing so. The students also included only one cohort per discipline. So changes we plan to implement based on this activity, we actually did implement them a couple weeks ago. We had the opportunity to carry this out again and use some of the information we got from the students to make it better this year. So one of the things we wanted to do were to include additional disciplines such as pharmacy, nursing, physician assistant students, and we did not get to increase the disciplines this year. We did get to increase the critical thinking opportunities regarding team roles, responsibilities, and communication. We found that we really needed to focus our objectives and focus our purpose, not only for the whole activity, but for each individual station. And by doing that, we focused in on the roles and responsibilities more so than the actual tasks. And we found that that was very successful to bring that in and have all the faculty on the same page. We also used a standardized patient. We introduced that patient to the students during the initial introduction, and we improved our threading of that patient case at each station to make sure that the students were able to critically think about that patient and their role and responsibility and interaction as a team to provide comprehensive geriatric care. And then, as suggested by the students, we provided the case study before the activity, and in that way the students could consider the case and think about their role and be better able to share how they fit into the case and where their place was on the team, because they were more familiar with the case. So we saw a significant increase in student perceptions of the value of interprofessional education. We also saw an increase in interest of interprofessional education and in their curiosity about it. The students want more interdisciplinary activities. They enjoyed it. Some students were nervous going in. They were unsure of where they fit in and maybe intimidated by the different disciplines, and they came away feeling that they were all different but equal, and that they all had something to contribute. They really had a better understanding of their own profession's contribution and value to the team and the importance of communication. So in conclusion, IPE with focus on older adults was an effective way to increase student understanding and respect toward other healthcare professionals. It enhanced the students' abilities, their values, and their comfort with collaborative practice. And it enhanced their attitudes towards older adults. And really is the first step towards preparing students to work in a multidisciplinary workplace. So now I would just like to field any questions.
Hello, you've just got me. I'm Jo, I'm the moderator. That was fantastic. I have learned so much. So I'm a learning designer and I work with the people designing the courses, and I'm absorbing everything you've just presented. It's such a great initiative. So for me, I get that students gained a lot from the experience, but in addition to that, do you feel like you've got any new ideas about how we can better prepare students for their interprofessional teamwork? So it's one thing to give them more opportunities to work collaboratively. Do you feel that they went in as prepared as they could be, or should we be doing more?
Well, I'll take that at first and then I'll pass it to my colleagues. Yes, I think we should be doing more. This was their first introduction to it in the curriculum, and I would say they're starving for more. They loved it. They were coming up to us without being asked afterwards, saying how much they enjoyed it. I think they really enjoyed meeting their colleagues, talking about it. Like I said, it validated their own profession, but also their contribution to the team. I think they enjoyed seeing the faculty, how much we enjoyed it. We really have loved meeting each other and working together. And I think they really saw that we valued it. We were learning from each other. And I think they really desire to go deeper in the future with even more deeper with critical thinking activities and actually treating patients together and seeing how each discipline might approach a new evaluation and a treatment so that they can compare and contrast the different approaches and see how I think they really wanted to know what the other profession was doing when they weren't there.
Yeah. Yeah.
Absolutely.
Yeah, that's fantastic. And so one of the groups, might have been the physical therapists, were asking to see the case beforehand. So obviously they felt like they needed to have some grounding before they came to treat the person. Did the medical people have that same reaction, or were they more confident that they could look at what was in front of them and sort of quickly assimilate?
Would you like to go? Sure. I'm going to hand off.
Sure. So even though I'm a pharmacist, I help here at the medical school. And from what I can remember, I think it was collectively across the board, medical students, physical therapy students, and occupational therapy students really just wanted some preparatory material, in particular the case. So as we had talked about, so that they can see the information and be prepared so that they're ready to discuss right away with their group, so that it wasn't just kind of a new thing right away.
That's great. So this is helping. I love the concept, and I'm just unpacking it in my head about what might be the challenges. So I agree, sharing the case beforehand is great for students. As a team coming together to get your students together, was there any particular challenge that you've had to sort of overcome? I mean, in my institution, timetabling of students' availability and rooms would be a significant challenge. Did you face things like that?
Sure. So one of the challenges is The SIM Center, which we're actually in right now here at Augusta University, is shared among nearly all other health professions here. So we had to make sure to reserve rooms ahead of time. I know for the one that we reran again just 2 weeks ago, we had to juggle a little bit on a Wednesday when there were several other groups that were in the center doing other activities. So absolutely. And I think it really just comes with preparing ahead of time. And also, one of the things that we do want to do better is, can we make the groups more equal? Because even this year it was a little bit more difficult because we do have more medical students.
Yeah, that's a fairly common thing, I think, is enrollments are always higher in the medical field. Yeah.
I would that it's a commitment from the different programs to participate. And so I know with the physical therapy students, their instructor, they had a different class at the time, and their instructor recorded their class so that we could have a certain number come out. So this was extra for them to participate, and we just decided as a program it was a priority and asked the faculty to adjust to it. And the students were more than willing to have to make up class later because they valued the activity so much.
Such an authentic learning opportunity. I just think it's brilliant what you've achieved, and I'll look forward to hearing more about your insights. And, you were talking about changes to measuring their empathy and things like that. It'll be really interesting to see how that progresses over time.
All right. Patty, do you want to come back?
Well, thank you so much for having us. We're really excited to be able to present our research and our activity with people. We hope that this inspires you to go back to your university and do this with your students. I can't tell you what a great honor it's been for us to be involved with this, and we look forward to many, many years of doing this with our students.
Thank you so much for sharing. I definitely, people will be viewing the presentations. There's quite a few running simultaneously, but I'll be recommending it to quite a few because what you're doing is very unique and I think very important work.
Thank you so much. And here's our contact information. If anyone has any further questions that you'd like to ask, we're available via email and we'd love to chat with you.